According to the Multiple Sclerosis News Today, the National MS Society recently conducted a study where they found that nearly 1 million people have been diagnosed with multiple sclerosis. When I was young, my mother herself was diagnosed with MS, so growing up I have been able to gain knowledge and experience with the disease, how it can directly affect the person diagnosed, and then those people who are related to them and friends of that person. Today I plan on covering with you what exactly multiple sclerosis is, how it affects those people who are diagnosed and their families and friends, the symptoms that they can experience before they're diagnosed and after they are diagnosed, and the certain treatments that they can receive to delay the progression of MS or just to help benefit their overall well-being. To begin, I would like to tell you what exactly multiple sclerosis is. According to the Gale Encyclopedia of Medicine, multiple sclerosis, or MS for short, is a chronic autoimmune disorder that affects movement, sensations, and bodily functions. It is caused by the destruction of the myelin insulation covering the nerve fibers, or neuron, that surround the central nervous system, which consists of the brain and the spinal cord. According to the National Multiple Sclerosis Society webpage, some of the more common symptoms that people can experience are fatigue, which occurs in nearly 80% of diagnosed patients, spasticity, which refers to the feeling or stiffness of involuntary muscle spasms, bladder problems such as UTIs or kidney stones, which also occurs in 80% of patients. Some of the less common symptoms include swallowing problems as a result of damage of the nerves controlling the small muscles around the throat and the mouth, speech problems, which can include slurring of words and loss of volume in someone's speech, and tremors, which is uncontrollable shaking, which happens a lot of times in their arms or their legs. Each person who is diagnosed with MS can experience different symptoms and at different rates, because each person, it's like no shoe fits the same two people. They are diagnosed at different ages and they all experience different symptoms. Now that you know the factual information about MS, I would like to tell you about some of the treatments that they can receive if they are diagnosed. A variety of treatments are given to patients who are diagnosed with multiple sclerosis. According to the MayoClinic.org, some of the treatments for the symptoms that they occur include physical or occupational therapy. This will help with exercising the certain muscles that can be affected and can help improve everyday tasks, such as like squeezing a stress ball can improve movement of the hands if that is an area that is affected. Muscle relaxants such as tizanidine or Xanaflex may help with stiffness or muscle spasms in the legs. I know my mother takes that so that way her legs can relax and not be so stiff all the time so she isn't in pain. And medication for other symptoms of people who are diagnosed, such as depression, bladder, or pain treatments. Now, after knowing some more of the treatments that people may receive, I would like to share some helpful tips to understand your reactions and interactions with dealing with people who have been diagnosed with MS. Learning to cope with MS can be very hard for the people who are diagnosed and the people who surround that person. It really depends on how each person wants to handle it. Some kind of like to shut it out and some will accept it and embrace it. Some of the generic tips for helping someone who has been diagnosed are listed by Corinne Miller from Self.com, which include, you should understand that there is a lot of uncertainty with MS. Like I said before, each person is going to be different and affect them differently, so you never can guarantee a certain treatment will work or that they'll experience certain symptoms. You should treat that person the same way you would treat them regardless if they had it or not. That's what they really want. Yes, they receive special treatment just like any other person who has a disability sometimes, but that doesn't mean they want you to shut them out of your life because you learn that they are diagnosed. or that they want to be treated even special sometimes. They just want to live their life as normal as they can. You have to be flexible with your understanding of it. It's best to do your research about the disease, because then you can gain that knowledge and learn about what they might be going through so you can better understand it yourself. That being said, you should learn more about the disease. They have many web pages, and I know that they do a run each year for MS to gain donations, and I've run in that personally, and it's a great experience to see so many people who have MS or that are supporting MS, and if they don't even know someone with it, it's a really great bonding experience for everyone to come together. Offering help with everyday tasks. You wouldn't think that that would be so supportive of someone, but it really is. Such as if someone has problems with their hands or their arms and they can't brush their hair, just by offering to help brush their hair or do their hair every day really helps them feel better about themselves, because they feel put together and that they have people that do support them. And then supporting charities that go along with MS can be really beneficial, because they are constantly doing research about what MS is and how they can try to find cures and things like that. Sometimes having a disability can be a drawback. My mother was diagnosed when I was in 3rd grade and was completely wheelchair bound by the time I was in 5th grade. So I had to grow up really fast, and I had to quit a lot of sports and after school activities because I had no way of getting to them, because my dad became the sole provider for the family, so he was working extra hours and having to come up with 2 incomes for one household. It caused a lot of stress on the family. My mom spent a lot of time in and out of the hospital because of UTIs and her kidney stones, which a lot of other MS patients experience. So much that we became on first name basis with the cafeteria people in the hospital. But not all the time does it have its drawbacks. Sometimes it has its perks, such as we get to cut in line at the airport, and we get to park up front at pretty much every single place that we go to. In conclusion, today I have informed you about multiple sclerosis. We should all be aware of those who are around us who have MS. It affects more than you think. And in the future, I hope to just help discover a cure for multiple sclerosis, or at least a treatment that can help delay the progression of it. Always be aware of your actions with those who have MS, and you can always help donate and do more research if you would like by going to www.nationalmssociety.org to help contribute. Thank you.